Hi, Jacob with Heart of Texas Physical Therapy here again with my buddy Josue, who's a clinician and a colleague. We just wanted to talk about a hot button issue with a lot of people these days, and that's back pain.
So back pain is inevitable. Usually everyone at some point in their lifetime will have at least some sort of back pain going on throughout their lives. And why is this? It's because we're starting to be such a sedentary society. A lot of us have 8 to 5 jobs where we're sitting at a desk all day and we don't get up and stretch and move like our bodies need to. It slowly starts to creep up on us, and next thing you know, we're having issues simply walking, lifting simple objects off the ground. You can't pick up your child sometimes without the back pain going on. And there's a lot of different things we can do here that'll help out with that.
Yeah, here we focus primarily on what's the underlying problem and why are you having the back pain problem. The typical management for these issues is people will go to their physician and the physician will send them to pain management, and next thing you know, you're getting injections, and pain medication. More pain medication than most people need, and that's kind of a growing epidemic in the country right now, is opioid prescriptions. But really, what should be happening is the first thing you should be doing is coming to physical therapy so that we can address the underlying dysfunction, the underlying problem. And think of it like this: our spines are basically shock absorbers. We spend 24/7, 365 on a planet where gravity is constantly sandwiching our spines down like a spring. And over time, that causes degeneration, it causes pain, starts pinching on nerves, it starts sending pain shooting down into your legs. It starts hurting when you do simple activities like simply just rolling over in bed. So bottom line is when you come to see a physical therapist, we're going to get to the bottom of what's actually causing your pain, and we're going to develop a plan to fix it and eliminate the pain. One of the number one things we do with so many patients in this clinic specifically is we decompress the spine through either manual traction or I think that we're actually the only PT clinic in town that actually has inversion therapy. But we pick and choose our battles with who we actually use inversion therapy for, but it works wonders. And then we also address the issue of whenever we decompress and whenever we get your spine movement, because remember, movement heals. We also have to stabilize and strengthen as well.
So with stabilizing, we make sure that the muscles around your spine that are meant to protect you are up and firing, that they're working correctly all the time. This, in addition to the decompression, really helps out with relieving the pain and getting rid of the underlying cause of what's causing the back pain.
So in other words, you decompress the spine, you relieve the pinch on all these structures that are irritated, but then you don't want to leave the spine too mobile, basically, so you have to stabilize. So that's why in the fitness world, you go to the gym and everybody's about core, core, core. Well, it's true. You need to stabilize and strengthen the heck out of your core so that you don't have abnormal body mechanics and movement patterns when you're doing, especially when you get to higher fitness level. You don't want to be doing something that's going to cause damage to your backbone and you're not strong enough in your core to handle it. So not only do we address the underlying problem, but we get you to a higher level of fitness and a higher level of health and well-being so that this problem doesn't rear its ugly head in the future. So again, thanks so much for watching these videos. If you need to, if you don't want to come to therapy right off the bat and you want to take a little bit of time on your own, we do have these free tips guides on the website. They're free. Download them. They're strategies and tips that we use with our patients in the clinic. They really do work, and they help you to progress on your own. Ultimately, we would love to hear from you if you want to talk about your situation and what you've been dealing with for a long time and see how we can help you. So thanks again from myself and Josue. We look forward to talking to you. Thanks. Bye.